Thank you very much. It's been very interesting, and I'm glad to hear this. Especially want to address the young mums over there, and yeah, wow. We deal with lots of breast lumps, and I certainly will be taking a lot more interest and taking a lot more seriously after listening to you. With your association Beat, how can women access your association? Is that through the Cancer Council, or is it, how do they actually get in touch with you?
We're in their initial process of getting everything all up and running at the moment. I've got some business cards if anyone would like some after. We've got a Facebook page and an Instagram page, a LinkedIn page. What we're hoping is eventually that we'll be able to offer some assistance similar to what some of the other charities offer. We're just in the process of, obviously with my health issues at the moment, I just haven't had a chance to actually set the charity side of it up. But yeah, we would like to be able to financially assist, because that's a massive thing. But in the meantime, yeah, they can get in touch with us, and we have some picnics and little photo shoot days and things like that in the meantime, just to get to know other people who are like dealing with the same thing, which is really good.
So yeah, that's how I found Linda, through Facebook. I was scrolling on a Saturday night, and we were talking about this. I'd just come off an education committee meeting, and it just kind of came up on my feed, and I was like, oh, they'd be amazing to come and talk. So yeah, just scroll, you'll find them. Any other questions? No?
Sorry, can I ask a question?
Yeah, of course.
I'd just like to ask Christine that question. I was just wondering, when you're talking about disease in newborns, is there an implication then that the immune systems of those children are sort of substandard? I mean, obviously they're very, very young and not fully developed at that stage anyway, although some of them were months down the line. But is there an implication that that is the case, if they're not recognising cells which are only half similar to their own and are also cancers as foreign?
Thank you.
That's another part.
Thank you. I think it's really tricky because the risk of the infant having cancer transmitted from the mother is just so rare.
Yeah.
And in all honesty, we just know very little about it. In fact, it's actually probably quite the opposite, because interestingly, a lot of these cases didn't present until years or, at least many months later.
Yeah.
So I guess the short answer to your question is we don't know.
Yeah.
But there's certainly no implication that the infant has a weakened immune system.
Okay. I guess sort of what I was leading into a bit was, I mean, I presume, it is very rare, because the placenta is a barrier. But I guess I wondered, is it possible then that in women who are pregnant, there is more frequently transfer of cells in people who have cancer, and it's possible that the infant's immune system is actually recognising and clearing those cells. This is all very hypothetical. But then that could actually, that they would have antibodies against those cells, that could actually be used therapeutically.
It's a really interesting question. I'm not sure.
Yeah.
And I realise now that we are talking about this, I hope I haven't incited any fear in any of you.
Oh, no,
that you
sure.
have children, and that this is just so exceptionally rare.
Yeah, I think we're all past
that we, in all honesty, we know very little.
Yeah, no, I was just curious
Yeah.
from a therapeutic perspective.
Yeah.